Hi friends, welcome back. Today I'm going to talk about mouth cancer. As a healthcare professional, it is my duty to make you aware about this condition. Now I'll be talking about what is mouth cancer, why does it happen, where can you expect in the mouth, how to diagnose it, how this can be treated, what to expect from the recovery after the treatment, and how to prevent it. If you're watching us for the first time, welcome to Meet Your Teeth. My name is Mevish. I am a dental professional and my aim is to create dental awareness because your health and well-being is our priority. So all this information that you'll be watching today is from reputed organizations like WHO, National Institute of Dental and Craniofacial Research, and Cancer Research in UK. So why you should know about this? Well, because mouth cancer is getting fairly more common. I'll be presenting to you some of the statistics from the UK. Last year, about 8,772 people in the UK were diagnosed with mouth cancer. That means one person every hour. It is the 14th most common cancer in the UK, and about 7 people die because of this every day. That's quite too much, isn't it? It accounts for 2% of all the cancer deaths, and the deaths are mainly linked to the stage of diagnosis. That means the early we diagnose it, the better we can treat it. So what is mouth cancer? WHO states that one defining feature of cancer is the rapid formation of abnormal cells that grow beyond their usual boundaries, which then spread to the other parts of the body, affecting other organs, what we call as metastasis, which is the primary cause of death from cancer. Let's see the signs and symptoms. Please listen to this carefully because if you have any of these symptoms lasting for more than 2 to 3 weeks, then it has to be seen by your dentist or doctor. A sore, irritation, lump or thick patch in your mouth, lip or throat, a white or a red patch in your mouth, a sore throat or a feeling that something is caught in your throat, difficulty chewing, swallowing or speaking, difficulty moving your jaw or tongue, swelling of your jaw that causes dentures to fit poorly or become uncomfortable, numbness in your tongue or other areas of your mouth, and ear pain. So where does it appear in the mouth? Well, it could occur anywhere, but 34% develop on the tongue and 24% mouth ulcers develop on the tonsil area, so that is around this area here. Let's see the types of mouth cancer. There is a long list, but I'll be talking about some of the common mouth cancers. So basically, it is characterized by the type of the cell the cancer grows in. The most common being squamous cell carcinoma. So squamous cells are found in many areas of the body, including the inside of the mouth and in the skin. Adenocarcinoma is the cancer that develops inside the salivary glands, which help in producing the spit content in the mouth. Sarcoma, which grows from abnormalities in the bone, cartilage, muscle, or other tissue. Oral malignant melanoma, where cancer starts in the cells that produce skin pigment or color. So these appear as very dark, motile swellings that often bleed. Lymphoma, which grows from the cells usually found in lymph glands, but they can also grow in the mouth. Have you heard about precancerous lesions or conditions? So there are certain conditions that are not yet cancer, but if they are not treated, then there is a chance that these abnormal changes may become oral cancer. That's why we emphasize so much on regular dental visits, so that the dentist can pick up if there is abnormality and treat it accordingly. Let's see the causes and risk factors. Smoking. Around 66% of the mouth cancers are linked to smoking. Alcohol. About About 34% of all the mouth cancers happen because of excess amount of alcohol. Human papillomavirus, about 73% of the oropharyngeal cancers happen due to HPV. Age and gender, more than 65 years of age are at a higher risk. Males are twice likely to be affected with cancer than females. Areca nut or betel nut, poor diet, X-rays, gamma radiation, overexposure of sunlight, family history of cancer, environmental smoke, infections such as AIDS, HIV, organ transplant are all risk factors. So the best way to be safe is to avoid the common risk factors which are in our hand, like smoking and alcohol. Coming to diagnosis. So because oral cancer can spread quickly, early detection is important. And when you visit the dentist will check your face, neck, lips, and entire mouth for possible signs of cancer. And if there is anything suspicious, then they will refer you for further investigations. So to confirm the diagnosis, usually a biopsy and X-ray is needed, but sometimes the specialist may also require a CT scan, a PET scan, MRI, or endoscopy, depending upon where the cancer is present. Coming to the treatment, it will depend on various factors. So depending upon your general health, where in the mouth the cancer is present, the size and type of the cancer, and whether it has spread to other areas or not. So depending upon this, the specialist would recommend having a surgery, radiotherapy, chemotherapy, or combination of the above treatments. So the dentist or the doctor would refer you to a specialist who will take care of you and recommend you the most appropriate treatment. Also, you may need to liaise with other healthcare professionals such as dentists, plastic surgeons, speech pathologists, dietitians, and mental health counselors. As a dental professional, I see these as some of the challenges. So there is still a large group of people who do not have enough access to the dentist. Because of various reasons, the diagnosis of oral cancer gets delayed. COVID-19 has made things a bit more worse. So because of that, we're not able to see patients as frequently as we used to do in the past. And in many countries, the cost of the treatment for mouth cancers is really huge. So most of the people cannot afford it, and lifestyle choice. So we can give you all the information to prevent cancers, but ultimately it is your decision to change your lifestyle accordingly to prevent the risk factors. So some of the solutions I see for this could be, if the dental practices operate more effectively, training for healthcare professionals, free dental checkups, new policies to avoid smoking and alcohol, human papillomavirus awareness, and education to the general public regarding oral cancers. So let's see, what can you do to prevent mouth cancer? No smoking or using tobacco in any form. Do not drink alcohol more than 14 units per week, and it's best to spread it evenly over 3 or more days. Having a well-balanced diet, which includes fresh fruits, vegetables, and regular dental checkups. So if you are diagnosed with oral cancer, it is advisable that you consult your dentist before you undergo the cancer treatment, because oral cancer and its treatment can cause dental problems. It's important that your mouth is in a healthy state before the cancer treatment begins. So see your dentist for a checkup, and if possible, before starting cancer treatment, to give your mouth time to heal after any dental work you might need. Before, during, and after cancer treatment, ask your healthcare provider for ways to control pain and other symptoms, and to relieve the side effects of the treatment. You can also talk to your healthcare team about financial aid, transportation, emotional and social support for yourself and your family. Finally, coming to recovery from oral cancer treatment. So the recovery for each type of treatment will vary, but because of the high amount of radiation or because of the strong medications, there can be a lot of side effects that you can notice. So it's best to consult your dentist frequently to have regular discussions, and we can help you cope up better with the side effects. Some of the common side effects include pain, discomfort, swelling, scarring of the area, dry mouth, tooth decay, sore, bleeding gums, jaw stiffness, tiredness. Some of the side effects from chemotherapy include hair loss, painful gums, mouth, bleeding mouth, severe anemia, weakness, poor appetite, nausea, vomiting, diarrhea, lip sores, numbness. So if the cancer is quite extensive, you may also need reconstruction and rehabilitation after the oral cancer treatment, which you can discuss with the specialist. That's it for today. Thanks for watching. If you find this video useful, please share it with your family and friends and keep spreading awareness regarding oral cancers. Also, if you have any questions, please get in touch on our various social media platforms. In the past, we also did a video on differentiation between a usual ulcer and a cancerous ulcer. So if you're interested, please find the link attached in the description box below. Take care. Bye.